Yes, I think that's a real challenge right now. No one wants to take responsibility, and it's challenging because yes, while the vendors can provide some level of education, it's usually the same type of education that they'd provide when they're rolling out, a new feature or whatever. It's minimal. It's not designed for the use case, right? It's designed for understanding the features of the technology or the software, because it's usually in software. This is a normal thing for people to provide some level of user education, but that's not what this is about, and it's not what's called for in the EU AI Act, right? So that's the challenge. I did hear um, someone commented, maybe it was on one of your webinars, that she was of the opinion, she works, with a healthcare institution, um, that the healthcare institution people don't have the expertise or whatever, and it should rely at least somewhat on the vendors, and I didn't agree with that. um, Only because the vendors are not going to know enough either about the healthcare or how it's integrated within, the workflow, even if they helped, integrate it into the workflow. So I think it's a challenge. That's why there's, consultants like myself or larger companies that provide consultation services in this area. It's an emerging area. I don't think there's necessarily a lot of resources in the EU to match what needs to happen based upon the legislation. Someone did reach out to me, and he is in Norway, um, and said, "This type of education I do already for cybersecurity. And maybe I should consider doing some aspect of AI as well." And I said, "Well, I'm happy to partner with you." And then he reached out to me and said, "Well, yeah, that'd be great, but right now I'm kind of tied up in some other projects, so let's talk soon," right? So I see it as a big issue. It's an opportunity, of course. And I think that people aren't really aware of the extent to which the requirement is quite significant. It's not just like a one-time course you're done, right? It's really about providing AI literacy within your workforce, and AI is going to change constantly. So it needs to be continuous, and it needs to be a type of thing, everyone does annual cybersecurity. It probably needs to be more than annual because the change is so rapid, but there is a way to integrate it within a workplace. You probably just need someone, to come in from a consultation space, help you develop a plan, right? Like even myself, I can help that organization develop a plan for training. They probably don't want me to do all of that training for them throughout the year. Maybe a couple initial ones, also do some coaching with leadership. So there's internal resources with within that institution to do ongoing training. So I think there's ways to approach it. Um, the legislation is fairly clear of what the comprehensiveness and what it needs to entail. It doesn't tell people how to execute it, and I think that's the challenge. Now, the good news, there's a little bit of good news here. The deadline of February 2nd, as I understand it, and I think some lawyers have weighed in on this, it's not a everything has to be done, scramble to get it done by February 2nd. If you have a plan to roll out the level of health literacy that's needed within your organization by February 2nd, initiating a plan and saying, here's what we are doing will serve you well. And will probably meet the letter of what's being called for, because there's no fine attached to the February 2nd deadline for training. The fines come later on the implementation side. If you haven't done security audits, if you haven't passed those audits, if you haven't reported security audits, then they'll look backward and say, well, what have you done? And if you don't have your training plan in place, that's going to cause additional liability for that company and, maybe increase your fine or your liability. So there is a silver lining here, but people don't have time to just kind of wait it out or, wait for the lawyers to kind of come with a solid decision, because this is a gray area, right? Don't wait around for not being legally compliant. Don't wait around until someone says, wait a second, what did you do? Be proactive. Start considering what you need to do for training plans. I posted some resources. It's not the full thing I would do. It's maybe like three or four things within an outline to kind of say, here's what you should cover. Here's how you could do it. Um, contact me for more information. I'm happy to help people work on that plan and offer their initial training and ongoing coaching for leadership once they have internal resources of people that are trained to kind of answer questions, say how do we handle this issue, um, or various other things, particularly since most institutions, particularly in healthcare, are going to take a cautious approach to rolling out AI technology. They'll start with the back office workflows. They'll start with the predictive AI. They probably already are doing predictive AI, right? They'll start with the robotic process automated type of AI before they have generative AI exposed, in an external facing application. But as I think most people know, and there's a lot of research that to support this, most people's employees, their staff are already using generative AI, ChatGPT, or something to ask a question on the QT, right? They may not, it may be in violation actually of the official policy, but you can't stop people from using this because it is a helpful tool to answer questions on the fly in particular. I'm in a workplace setting, this came up for the first time. Let me just ask ChatGPT. I'm not going to use that necessarily as it's a valid medical opinion, but it gives you some amount of feedback. And this is what employees are looking for, and they're doing on their own. So if workforces, healthcare institutions, um, healthcare systems are not prepared for this, they're in for a world of trouble. And really some challenges in terms of how to best integrate this now within your workflow, within what you're trying to provide as key and core services. And let's face it, in healthcare, this needs to be about people first and patients first. And we should not be uh, integrating AI. Responsible AI means human first, healthcare patient first. If we're not doing that, we're not doing it responsibly. A key aspect of putting humans first in this matrix is around AI literacy, understanding what you're doing, understanding the risk involved, understanding how to minimize those risks, um, understanding how to use this ethically and responsibly.